Taoiseach, the consequences of the targeting of discretionary medical cards cannot be in doubt. The claim that these were unintended does not stand up. Absolutely does not stand up. The government and a whole series of voices have defended this decision, and indeed, referencing the centralisation of the processing of medical card applications is merely a smokescreen to cover your embarrassment and to hide your shame. Now, Minister Riley has indicated yesterday that he has categorical assurances from fellow ministers, he didn't say all ministers, that the 13 million projected cost of the reissuing of these cards would be new money for the health budget and would not result in cuts elsewhere across the health services. Who are these ministers? Taoiseach, has Dr Riley full cabinet assurance that additional monies will be provided, or is it being considered that the monies that were set aside for 2014 to facilitate the rollout of free GP care for all up to the age of 6 years will not now be utilised in that regard this year, and that monies, or some of it, would be employed in this regard? Taking into account the criteria that John Hennessy outlined this morning on Morning Ireland, the Director of Primary Care, he outlined 3 criteria that are being taken into account. The second of those must have completed review process during the period. Taoiseach, there is a huge discrepancy, 15,000 as against some 30,000 cards removed. There is no question in the minds of deputies right across this chamber that many people who had their discretionary so-called medical card taken from them simply looked at the situation and said there is no point. There is only but a roller coaster to cull, to cull, to cull, and they did not proceed. Are these people going to be excluded from consideration now? They validly held discretionary medical cards. They did not proceed, and therefore, by the criteria that you've laid down, you're going to compound their hurt. And if I can just finally in this regard, the primary care reimbursement scheme, that's the body that oversees the medical cards reimbursement scheme. My question is, what of the need, and I stress need, to reimburse those families, many of them with children with grave illnesses and disabilities, to reimburse them for the cost that they have incurred, costs that they could not afford over the period from 2011, from the 1st of July up to the 31st of May just gone by. That needs to also happen.
Deputy Caoláin, I appreciate the way you phrase your question here. One of the issues that arose around the country in centralising the assessment system was that there was clearly a difference from one location to another around the country. And people would say, how come that person was able to get a card when I couldn't and I'm in the same circumstances? And the evidence...
Sorry, would you say
stick with your scrap metal bill, you. The evidence, Deputy Caoláin, was that in some locations around the country, the allocation was very much higher than in other cases. So the centralisation of this was not a smokescreen, but was, if you like, was designed to have an assessment that would be fair for everybody. And clearly there were enormous difficulties for some members in that regard. So it wasn't a smokescreen at all. The second point that you raise is about the endorsement of the extra monies, the 13 million, for the Minister for Health in respect of the return of the 15,000 cards who lost them on the discretionary review. That is a Cabinet decision. It is a collective decision of all the ministers of the Cabinet, and it's endorsed and decided unanimously in that regard, dealing with your second point. Ministers already dealt with the question of compensation. The important thing here, Deputy Caoláin, is that the Government have made a very clear decision to provide extra money to return the 15,000 cards that were who either held a medical card or a GP card on a discretionary basis and who had completed the eligibility review between the 1st of July 2011 and the 31st of May 2014. As I pointed out in respect of the earlier question, if there were reasons why people were not in a position to respond to the review or to complete the range of questions, that matter has to be taken into account by the Health Service Executive, as confirmed this morning.
Deputy Caoláin.
In relation to that last point, I think it is very, very important that the door is not closed on those who, for a variety of reasons, did not respond because they felt absolutely intimidated by the entire barrage that came from government insisting that this call must take place in the whole interest of so-called probity. So I would hope that that door has been left open for those. And will there be a process of appeal or review for those who have had their cards cut over the relevant period but who do not receive a letter over the coming weeks, as Mr Hennessy has indicated? Will there be an opportunity for them to represent? And what of those who applied for cards on discretionary grounds over the relevant period and had their applications refused? The same criteria of assessment was applied to those over the period from 2011 to 2014. Surely they're equally entitled now to have their position also taken into account. And Taoiseach, lastly, in relation to, it wasn't only the targeting of people who were holding discretionary medical cards, the medical cards that many voices on the government benches claim never existed, but what of the over 70s, Taoiseach?
Thank you.
What of the over 70s who were targeted over the exact same period and who have gone through undoubted anguish and suffering in many cases because they have lost either their medical card, certainly, and have had to depend on the GP only, a very inadequate replacement for what they previously had great faith in. Thank you.
Well, you've raised a number of questions. The Minister for Health requested a detailed examination, Deputy Caoláin, of the 78,000 people who held discretionary medical cards that were in circulation on the 1st of March 2011. What their status was on the 1st of March of this year. And here's the information relevant to those 78,000. 33% still held a medical card on a discretionary basis, 25,398. 49% now have a medical card based on assessment of means, 37,906. 19% no longer hold a medical card. That's 14,621 people, which was made up of 3% of people who were deceased, 2,521. 7% did not respond to correspondence from the HSE. That's 5,145 people. 2% did not complete the review process after initially engaging with the Health Service Executive. That was documentation wasn't provided. That amounted to 1,522 people. And 7% completed the review process and were found to be ineligible for a medical card. That's 5,433 people. So from 2011 to March of this year, of those 78,000 who were awarded medical cards on a discretionary basis, that's the current status. And those who lost the card on review under the assessment basis, who had their cards granted on discretionary allocation, will have those cards restored, and that's portion of the 13 million cost which the Cabinet approved collectively and unanimously yesterday to deal with this matter. Obviously I won't have time to deal with the other elements of your question, Deputy Caoláin.
Deputy Murphy.